as part of the NIHR Insight program, how you start to engage in research really focused on underrepresented professions. So I'm Ian Maidment. I'm a professor of clinical pharmacy at Aston University. By background, I'm a pharmacist. So I'm from an underrepresented profession. With Joanne Plum, who's also on the call, we're co-chairing it. So Joanne, do you want to introduce yourself?
Thank you, Ian. So I'm Jo Plum. I'm Director of Research and Innovation here at University Hospitals Birmingham. I'm a nurse by background. I've had a career in operational research and clinical delivery for the last 20 years, and I'm co-chairing with Ian. So pleased that you've all joined. Really keen to hear from our speakers, their experiences, and then we'll open it up to quick Q&A afterwards, won't we, Ian?
We will. So the quick run for the program is Amelia's going to give you an overview of the Insight program. Then we're going to have two case study type approaches from a pharmacist, Zakia, and a nurse, Joanne. Then Nicola's going to give a short overview of various NIHR opportunities, and then any questions when you can either put your hand up or put something in the chat. So like everyone else, I'm passionate about building research in all professions. If we're going to solve these long-standing problems, we need all professions involved. Obviously, I'm a pharmacist, so I'm keen that pharmacists are involved, but nurses and others are really, really important. Nurses are by far the most numerous profession in the health service, and we need to get every profession engaged in research. So, I'm going to hand over to Amelia now. If you want to quickly share your slides and talk about the Insight program.
Thank you, Ian. So my name's Amelia Swift, and I am a reader in health professional education. I'm a nurse by background. I work at the University of Birmingham, where I run the MRes in clinical health research. And my main role really is as the lead of a large consortium of universities that deliver something called the NIHR Insight programme for the West Midlands. And this engagement webinar is part of a series of webinars that our organisation or consortium puts on to help introduce people to the world of research and open your eyes to all sorts of possibilities that there are for you if you should get involved. So I just want to spend a couple of minutes telling you about the Insight programme. It is a NIHR funded opportunity, and it provides you with tuition fees and a stipend to undertake a Masters of Research or MSc in a research-based topic. There are 9 partner universities. There's currently 7 partner universities for this application round for Insight. It's just closed today. We will be hopefully having another round of applications next academic year, and then there will be 9 universities as the partner organisations, and these universities between them offer about 15 different masters courses which all offer you research training at masters level, so help you get started on that pathway to being able to undertake your own research project in an area of interest for you. On the screen there you will see a QR code, and if you follow that QR code it goes to our website. There's lots of information on there about who is eligible to apply for this funding, but essentially any health or care professional that's registered with a professional body. Also, it's open to final year undergraduate students who are expecting to graduate and register. So essentially, it's open to anybody and everybody. One of the things you can do if you're not ready to undertake your Masters in Research programme is engage with the engagement programme. And if you go to the website where you registered for this, you'll see lots of different recordings of all of the different webinars that we're doing. And we've got a really exciting programme coming up over the next few years as well. Apart from being a registered health or care professional or working your way towards registration, to be eligible for the programme, you need to have been qualified for less than 5 years. Now, we do accept a break in service. So if you've left your career for a little while and come back and you've been working as a registered health or care professional for 5 years or less, you are very welcome to apply. There's an email address at the bottom there, and you can email that and you'll get in touch with me and the administrative support we have in the team to answer any questions you might have about it. I've been talking to some of our Insights students recently. Some of the things they really love about the programme include the community of practice that we have. So this is a regular opportunity for them to get together virtually with a cup of tea and have a chat about how things are going and give each other support. And one of the Insight students was saying to me just yesterday that this had been a real eye-opening opportunity, that they'd met people they didn't expect to meet, that they'd found lots in common, and it was offering a real source of strength and support in their development as they go through their master's programme. So it's not just the university community that you belong to, you will also belong to the Insight community as well. And we're just putting in this bid to run the programme again for the next 3 years. And that's been a really exciting time. We're building partnerships across the social care sector, ambulance sector, hospice sector, acute sector, you name it. I'm really noticing how our programmes are really well suited to a broad range of health and care professionals. So I urge you to use that QR code, take a look at the website and get in touch if you've got any questions. And that's all from me.
Thank you, Amelia. That's great. I don't know if you're able to stay on, take any questions at the end, or if you need to go. But thank you very much.
I'll just go off camera so I can carry on with our application, but I'll be here.
Okay, fantastic. So I'm now going to hand over to Zakia. Zakia is a pharmacist and is going to talk about her experiences. So Zakia, do you want to share your slides? We'll start to share them. And then, yeah, I can see them. They're not in presenter mode, but it's fine. They're in presenter mode now.
Okay.
Do you want to go ahead?
Thank you. Thanks, Ian. Hi, everyone. I'm Zakia. I'm a research fellow at the University of Birmingham, and I'll be talking to you about my experiences of developing a research career. So to start off, a little bit about me. I graduated with a Masters in Pharmacy from Aston University in 2013. I then completed my pre-registration year in community pharmacy and worked as a pharmacist for a few years before doing my PhD back at Aston. And after my PhD, I've stayed within academia and am currently working as a research fellow. So I thought I'd start with where my interest in research really began. And it developed during my master's dissertation in the final year of my pharmacy degree. And I remember choosing my topic, and I chose a literature review because I really enjoyed reading. I enjoyed independent work. I wasn't a huge fan of lab work. And so I thought a literature review was the best way to go. But when we started the project, it was clear that there wasn't actually enough literature on my topic area. And so we had to change direction, and we did semi-structured interviews with community pharmacists instead. And for me, that's where my interest in research really began. So it was fascinating for me to get out in the field and actually talk to community pharmacists about their experiences day to day in practice, and think about how the research I can do could actually impact their practice and ultimately improve the quality of life of patients. So the topic was looking at the role of community pharmacists in dementia care. And so I was able to go out and talk to pharmacists, think about some of the barriers that they're facing, and then put that together and develop some recommendations for the role of community pharmacists in dementia care. And I really enjoyed that whole process and found it really rewarding. But even though I really enjoyed research and I enjoyed that final year dissertation, I went down the role of community pharmacy because I was aware of that sort of potential to work in research, but I really did not know a lot about it at the time. And so I thought, you know, for me, it was always either community pharmacy or hospital pharmacy. I didn't enjoy hospital pharmacy very much, so I went down the community pharmacy route, and I started working as a locum pharmacist. I then moved to the position of a pharmacy manager at a very small independent pharmacy in London. And that was less than a year after I'd completed my pre-reg. So it was a massive jump. But I do enjoy a challenge. And for me, it was a really, really helpful experience, especially because it provided me with that real world data that I needed to guide my research project. So I was able to use all the experiences that I'd gained within practice to really guide the direction of my PhD. And I think that's something that really benefited my research. So I feel like practice is really important when it comes to thinking about research topics that you're going to go into. So I stayed in community pharmacy. I worked as a community pharmacy manager for over 2 years. But it got to the point where I was getting a little bit too comfortable, and I do enjoy a challenge. So I was starting to think about what else I could do to try and, you know, improve my skills and develop my career. And at the time, it wasn't actually mandatory to do the independent prescribing course. So I was thinking about perhaps going down that route and becoming an independent prescriber instead. But then I received an email from Aston University, which was very much out of the blue. I was not expecting it. And it was about a PhD position, funded PhD position at Aston University. It was co-supervised by Ian. So Ian was my master's supervisor, and this PhD was co-supervised by him. So it was very much out of the blue, but I was at a point in my career where I was thinking about all the different options and what I could go down. So it was a very real possibility for me. So then I had to kind of weigh up the options, and I did my sort of pros and cons list that I always do. And I needed to make the decision about whether to apply for a PhD or not. So when I was thinking about for it, I really enjoyed my master's dissertation, as I said. So I knew that I'd really enjoy doing a PhD, and I'd really enjoy the research aspect of it. I think for me, the most important part was that it was a topic area that I knew was important from my time in practice. So the topic was patient-centric medicine design. And whilst I was working in practice, I was constantly on the phone to suppliers, trying to get in specific brands of generic medicines because patients couldn't take certain shapes or sizes. And I knew it was a real problem. And the topic was basically exploring that a lot further. So for me, that was a massive pro. I was supervised by known and trusted academics. So obviously one of the supervisors was Ian, who was my master supervisor. But I also knew a couple of the other academics because I'd done my undergraduate degree at Aston. So I knew who the supervisors were. And that's obviously really important when you're considering research as well. And then there was this potential to sort of move away from community pharmacy and go down the career in academia. And that was, you know, quite interesting for me. I was always interested in research, so that was a massive positive for me as well. Against, I had settled in London at this point, and obviously doing the PhD would have required me to relocate. So that was a big step for me. I wasn't sure whether I'd be good enough. I think that's always a problem for a lot of us. You know, I'd done the master's dissertation, but a PhD is a whole different thing. And I really didn't know whether I'd be able to do it. But I think if you enjoy research and you enjoy learning and you're willing to learn new things and put yourself out there, then it's definitely worth giving it a go. And the salary is the last thing. So I was working as a pharmacy manager at that point, and obviously doing a PhD was a step down. It was a funded PhD, so you do get a stipend. I believe the stipend for PhDs, funded PhDs, is around 22,000 now, if I'm not mistaken, but correct me if I'm wrong, tax-free. So yeah, it depends on your individual circumstances and whether that's something that you'd be able to afford, depending on your own circumstances. So I decided to go for it. and I did the interview and thankfully was successful. And I started the PhD. It was a massive change from working as a community pharmacist. So within community pharmacy, it's sort of very rigid, very structured, 9 to 6, you go in, you do the job. A PhD was very independent. You are your own sort of boss, but you do need to make sure that you get the job done. And for me, like I say, the most interesting part was that ability to use the experience that I gained within practice to guide the direction of the PhD. So whilst the broad topic area was predefined, I was able to sort of guide it in different areas. So for example, the target population that we were looking at and things like that. So that was really interesting for me. The flexibility is great in academia. So like I say, there is a lot more flexibility, but you do need to make sure that you do get the work done. The time frames are sometimes very tight, so you do need to keep working very hard. I think the most important thing is developing transferable skills at the same time as doing your PhD. So whilst I was doing my PhD, I did a lot of teaching, a lot of lab work, a lot of practice teaching, and I undertook the PG cert. So I am a fellow of the Higher Education Academy and can go down the sort of teaching route if I wanted to. And so, yeah, definitely use every opportunity you can to develop those skills whilst you're doing research. It is really important to be adaptable and flexible during research, and that's why I've included this bit about COVID during the PhD. So COVID hit during the final year of my PhD. I had planned follow-up focus groups, so I'd spent a lot of time printing some 3D models that I designed and made. I'd recruited all my participants. I booked all the rooms, everything was ready. And then COVID hit and I had to cancel everything. And it was a shame because obviously you plan your work packages in advance. You know, this was something I planned to do at the start of my PhD, and it was going to bring all the work that I'd done together. So, you know, it was quite a big hit, but then you obviously have to, you know, be adaptable, flexible. So I had to cancel the focus groups and did a review of the literature instead on 3D printing. And I was still able to publish 2 high quality papers, so that was a positive, but there is always this need to be adaptable and flexible. So after my PhD, I knew that I did really enjoy research and I wanted to stay in research, but postdoc positions are difficult to get. And that's where registration with the General Pharmaceutical Council is really important. So I'd really recommend keeping that registration because you always have that flexibility to move back into practice if you need to. And so that's what I did. I moved back into community pharmacy and worked as a locum pharmacist. I'd kept up to date with practice whilst I was doing my PhD, so that was really helpful. And I worked as a locum pharmacist whilst I was applying for postdoc positions. And I got offered a post as a research fellow at Warwick Medical School. So working as research fellow, I was working on an NIHR Advanced Fellowship. So I believe that's called the NIHR Postdoctoral Award now, under a principal investigator. It was a fixed term contract. So that is one of the things to consider within academia, is that you are sometimes on fixed term contracts. The contract will come to an end and you'll need to find an alternative position or find your own funding. So it is something that researchers are often very aware of. But I think the major positive was doing a pharmacy degree. You have such a wide range of knowledge in so many different therapeutic areas that you can do research in so many different areas. So whilst my PhD was on medication adherence, this postdoc was actually on post-discharge care, so very different, but obviously doing pharmacy, you're aware of things like the discharge medicine service that I was able to bring into the project. So it was really interesting for me. And always use any opportunity within research to, again, develop your skills as much as you can. And so that's what I did during my time at Warwick. I was a co-lead of the Early Mid-Career Academic Staff Network. I presented at as many conferences as I could. So that's me presenting at the Society of Academic Primary Care Conference in 2024. I got a few publications out of that project as well. And I used it as an opportunity to develop my professional network. So that is key in academia. Always try and keep in touch with the academics that you meet. Academia is a very small world. You'll never know when you bump into them again. So developing those networks is key. So I am currently working as a research fellow at the University of Birmingham. It's another NIHR funded project, this time funded by the Research for Patient Benefit stream. Again, I'm working under a principal investigator. And again, it's a very different topic area. So I'm looking at improving the identification of work-related asthma. And again, I'm able to apply that pharmacy knowledge to a different topic area, which is really good. And it's great to be able to, always learn new things and work in different areas. Whilst I'm working on this project, I am developing a funding application to lead my own research. It is challenging because obviously you're working and then trying to submit your own funding application at the same time, and it's definitely a balancing act, but it's rewarding once you get the funding as well. So that's the ultimate aim, and I'm hoping to get that submitted soon. So in summary, your pharmacy degree provides you with a very unique ability to work in so many different therapeutic areas. Working in practice can be really beneficial. It can help to guide your research and identify topics that are really important within practice. Networking and maintaining those professional relationships in practice with other academics is really important. It is definitely a less structured environment, and there is a lot more flexibility, but like I say, you do need to make sure that you are getting the work done within the time frame. And the key for me is that opportunity to improve patient outcomes through research, which is a really big positive for me as well. And yeah, that's it. Thank you very much.
That's great. Thank you, Zakia. So we'll take any questions right at the end. So Joanne, if you want to get your presentation up and ready, that'd be great. So there it is. So again, thanks, Zakia. If you're happy to stay at the end, you can answer any questions. So I'll move on to Joanne now. Off you go.
Hi, yeah, my name is Jo McConaughey. I'm the Teenage Cancer Trust lead nurse for the West Midlands, based at University Hospitals Birmingham, but covering the whole region for teenage and young adult cancer. So you see the abbreviation TYA throughout the presentation. That's teenage and young adult. Can we go on to the next slide, please? So a little bit about me. So I've been a paediatric nurse since 2007. So definitely not an early career nurse, but certainly nurses, as we've said, are not well represented in research. And I would also say paediatric nurses particularly, don't see much research from paediatric nurses. I've always worked in paediatric oncology since I qualified, and later the ward I was working on attached a Teenage Cancer Trust unit to it, so we looked after up to the age of 24, 25. I've been the Teenage Cancer Trust lead nurse here in the West Midlands since 2020, and our TYA service cares for patients aged 13 to 24 with a cancer diagnosis, looking at their particular, their unique needs for being a young person, not a child, not an adult, and some of the specific needs that come alongside that. Part of what I noticed though around some of the patients that we looked after on the caseload was if they were in prison when they were receiving their cancer treatment, they weren't able to access the full TYA service that we would offer. So this would include things like peer support activities. So we would do activities outside of the hospital where young people could meet other young people. You know, you can't do that if you're in prison. Fertility preservation is really important to our patient population. How does that work if they're in prison? How do you get any time on your own with them? So just lots of the things we have in our sort of tool bag to be able to support young people through cancer treatment we weren't able to do if they were in prison. When I had a look into it, though, there is not a single piece of research or guidance around caring for young people with cancer in prison. There isn't a huge amount about caring for adult cancer patients in prison, but more so. So I applied to CCLG, which is sort of our professional sort of group of medics and nurses and AHPs who care for paediatric and TYA cancer patients. So me and a colleague applied to them for a grant to write some good practice guidance, which I have linked there. And as part of that, was in touch with a few different people at UHB to help me write that. And it was suggested that I could apply for a Chief Nurse Fellow programme at UHB as a way of funding a MRes and then being able to do more work into this project. Next slide, please. So just a little bit about Chief Nurse Fellow. For those that it might apply to, it's a chance for staff to be able to somehow improve the care or experience of services, and by using research and utilising the talents of the staff that are already at the hospital, particularly those sort of underrepresented professions in research, and offers an opportunity to develop a clinical academic role. So I've just put those details there for who that it's relevant to, and to do my MRes at the University of Birmingham. Next slide, please. So a little bit of background then around TYA cancer care. So there's just over 2,000 new cases of young people's cancer, so that's less than 1% of the total cancers diagnosed in the UK. And young people face a unique set of psychological concerns and challenges. I knew there was no research into TYA cancer patients. All I could find was one conference poster, and that was around the actual physical transferring of a patient rather than the care that was delivered. And then looking at some of the sort of national and international guidance around either young people in prison or cancer patients in prison, there was no mention of TYA cancer patients in World Health Organization guidance, and also in Bright Light, which is a big piece of work into TYA cancer care, big research project. They were actually not eligible for that research if they were in prison. So in no way were this sort of patient group being captured. Next slide, please. So I conducted a scoping review. As I already knew there was no research about young people, just broadened the scoping review question about what is known about needs and experiences of people in prison receiving cancer care. So 9 papers were reviewed, and the general sort of themes that were coming through: delayed diagnosis for patients that were diagnosed if they were in prison at the time, and that could be for several reasons. One of the main ones is the difficulty of getting a hospital GP appointment, and some of the delays in that. Delayed diagnosis, of course, means poorer outcomes. The research also talked about the impact of having security, i.e. the prison officers attached to your patient during their appointments, and the impact of that, and perhaps not it changing what you talk about or how you talk about, or you know, the support the prison officers would give that patient, worries about confidentiality. There were some issues that were raised about how the prison then manages a patient that's undergone cancer treatment. So examples were given about specialist diets, if they needed to have those, and also concerns about prescribing opiates for pain relief for these patients. Also issues then around end of treatment and when this coincided with the release from prison. So some patients were being lost to follow up because they were moving prisons and therefore needed to move hospitals, or they were released from prison and there was no way then to get hold of them or know where they were. Lots of communication challenges because Obviously, communication needs to go via the prison, so difficulties and communication challenges and who's allowed to know what. And also what came through was the needs of the professionals, so the need for education, the need for support, and the need for recognising the importance of the cancer treatment and appointments not being cancelled because there wasn't an escort available and things like that. Next slide, please. So my research question then, I did for my research, what are the nurses' experiences of caring for teenagers and young adults with cancer in prison? Next slide, please. So I undertook qualitative research. I can't say this, so I'm just going to say IPA, using an IPA methodology to because it's really about exploring the experiences of those nurses and understanding their own account of their experiences of caring for a young person in this situation. Experiences, of course, may be subjective, and knowledge is constructed from human perception. So it was really I needed a method which allowed me to delve into those nurses' experiences and how they'd interpreted those, and also how I needed as the researcher to reflect upon my own experience and assumptions, because I am a TYA cancer nurse, so I already came at this with a preconceived idea of what I thought these young people were missing out on. So the method then I undertook was semi-structured interviews with a topic guide. Nurses were recruited via professional forums, so either via Teenage Cancer Trust or for prison nurses via an RCN forum. I wasn't able to recruit any prison nurses. I didn't have any anybody volunteer, but I did recruit 5 specialist teenage and young adult nurses. Next slide, please. So yeah, that's who I was aiming for, specialist TYA nurses, recruited via professional forums. They needed to have cared for a TYA cancer patient in prison in England, and the reason it was England is because the NHS is NHS England service specifications that state what TYA cancer care should look like, and I was doing a lot of comparing to that. A purposive sample, so I wanted a selection of information-rich participants and 5 nurses in total. Thank you. So the interim results, so I've developed 4 themes. So the first one was around communication, both with the prison, but also the absence of the parent that you would normally see, what we call in triadic communication with TYA. So it's normally parent, young person and healthcare professional. The young people that were spoke about in this research had chosen not to tell their parents. So actually you have almost in the parent's place as a prison officer, but they do not replace the support that a parent or supporter would give. TYA cancer care as a whole not being able to deliver elements or having barriers to deliver elements of TYA cancer care. Prison is both the facilitator and enabler, so they're the people bringing the young person to the appointment, they're supporting them during the appointment, but as I say, they are providing the support that a chosen supporter would do, and also that it did seem to differ if the prison officer was young themselves. There might have been a bit of misplaced humour from the prison officers, and perhaps a lack of awareness of what might be supportive things to say, such as saying that your auntie and your grandmother and have died of cancer might not be the best approach to supporting the young person. And also then some of the assumptions that nurses made around criminal justice. So some of the nurses felt the sentence for the young person was too harsh. Some felt that well, there was a bit of a debate about whether you needed to be aware of the crime that the young person had committed, and then some of the difficulties in that in terms of how much do you need to know versus actually what you shouldn't know to be able to continue to deliver objective care to the young person. One consultant had said to the nurse that they didn't want this young person being treated on the teenage and young adult cancer unit, which is obviously something we would offer all young people. So the need to advocate for the young people going through that. I've just put in a couple of quotes that I found quite meaningful. So the need to be very protective of the patient, and being aware of how other people were responding to that patient, trying to protect them from that. Seeing them just like anybody else, like any other person that they would look after. Not really knowing what support they were allowed to offer. What were they allowed to do? What were they allowed to give to him? Were they allowed to go and visit? The fourth quote is actually around sperm banking. So it was encouraging to know that the young people did still have opportunity to preserve their fertility, but actually they had to do that procedure attached to a prison officer, which is not something that we would ever imagine as young adult nurses. Very much advocate for young people being spoken to around the importance of fertility preservation, but it's, as you can imagine, normally a very private procedure, and yeah, they had to be attached by a long chain. And then just an overwhelming feeling that young people are disadvantaged in that circumstance and not getting the normal service. Next slide, please. So limitations then to my study. All the patients were male, not on purpose, that's just how that had happened to be. And they all had the same or similar type of cancer. Now, I didn't collect specific information about the patients because I didn't want them to be identifiable, but they all had a very similar diagnosis, and the treatment for that similar diagnosis is outpatient treatment. So I couldn't really comment on caring for a young person as an inpatient or receiving palliative care, because this is largely a curative diagnosis. No prison nurses were recruited, so that did sort of minimise the sort of what we could glean from their side of looking after a young person with cancer in prison. England only, of course, you know, future research might broaden that slightly. And myself as a TYA nurse, like I say, I already came into this with a preconceived set of ideas about what I thought the answers would be, and my own experiences caring for young people in prison. And due to it being a master's and the ethical and sign off that you have to have from the Ministry of Justice to involve prisoners in research, it wasn't possible during the NRES. So that's why I interviewed nurses. So there's no patient voice in this research. So what would be really good is to be able to look at what the nurses felt was really difficult, such as having to do sperm banking attached to a prison officer. But it'd be really good to then hear from the young people about what they, you know, if you've been in prison for several years, it might feel like it should be a bigger deal to us than it would do to them. So it would be good to be able to get some patient voices in future research as well. Next slide, please. So yeah, research with the patients themselves, research with prison nurses. The idea obviously is to inform future practice for caring with TYAs in prison, to alleviate some of those questions that nurses ask when they have a patient. Can I do this? Can I do that? It would be, I'd like to now update that good practice guidance that I published, because that's largely an opinion piece, because there was no research, and to be able to inform education both for the TYA nurses in the hospital, but also nurses that look after young people in prison, and perhaps some awareness of the unique needs that they might have. Next slide, please. So just a little bit then about sort of me completing that research. I'm just in the writing up stage now. All the data analysis has been done. I'm just putting together now the complete thesis. I've had loads of support. I would say that's one of the biggest pluses for this experience. I've had loads of support from the university, from the other chief nurse fellows, but also colleagues in TYA Cancer Care that do research or have been part of research, and then the networking opportunities that it's provided as well. It's been really good to be able to present at things like this around what is a unique sort of research topic, and it's actually sparked a bit of interest, a bit of debate, you know, conversation around when we have young people in this situation. So that's been really really beneficial, and I've really enjoyed it. What's been the main challenge is still working full-time alongside getting the masters completed. So although it's in my work time as such, because of the role that I do, there isn't anyone else who does it. So you know, my work has still carried on as it did before I started the masters. So I think the biggest challenge is been fitting that in around your day to day, and that certainly is something that needs to be factored in, I think, to decisions to undertake research. But the benefits and what I've gained from doing that, you know, I've really enjoyed and have been worth it. But you know, I would be lying if I said I hadn't done quite a lot of this in my own time. So the question is now what? You know, I'm going to finish my thesis. I want to be able to publish my research, and then I don't know. A PhD has been mentioned, but I haven't quite recovered from the MRes yet to think about that. A PhD would be a great way to actually interview prisoners themselves as young people, to get their voice across. So that would be really exciting. I'm not quite sure I'm in for a career as a clinical academic, but I think that's what's great about it, is that you can do it alongside a clinical job day to day. So I'm certainly have really enjoyed making it part of my role and having you know, a project to work on. So yeah, next slide please. Oh, it's just references. So yeah, that's yeah, so that's me and my project, hopefully soon to be finished, and then I might need a bit of time to recover before I think about what's next.
That's great. Thank you, Jo. So take questions right at the end. So I'm now honed over to Nicola, who's just going to do a couple of slides on opportunities. So Nicola.
Great, thanks Ian. Can you see my slides there? Someone
We can see your slides.
Fantastic, lovely. So hi everybody, my name's Nick Anderson. So I'm a research delivery nurse by background. So I was responsible, started in 2003, so responsible for implementing and managing other people's research studies. And after doing that for a number of years, I became really very curious about undertaking my own research. So I actually became a nurse researcher alongside my clinical research delivery role, and I undertook a PhD exploring how we use patient-reported outcome measures in haemodialysis, because I was embedded within renal research. And so that's my background. So I work 3 days a week at the University of Birmingham, where I'm a postdoc research fellow doing my own research. But I also am a senior research leader for the NIHR for nursing and midwifery. And the aim of that role is very much to build research capacity and capability. And I'm passionate about doing that, not just for nurses and midwives, but for other health and care professionals. And I work alongside another colleague, Dr. Caroline Miller, who's got a senior research leadership role specifically for allied health professionals. But we work very closely together, and the aim being to support people to meet some of those challenges that Zakia and Jo have talked about when you want to have research as a component of your professional life. So some of those challenges, such as work-life balance, difficulty with not well-trod career pathways. There are only 0.01% of nurses who've got a PhD, and I found my voice when I undertook my PhD, I have to say. So, you know, I'm really passionate about, if that's an opportunity that you want to take up, that you have the chance to do that. And we asked Jo Joe and Zakia to speak today, because they really do demonstrate how one can have research as a component within your career. Joe, for example, she's come from an underrepresented profession, paediatric nursing. She's working with an unrepresented population of teenagers and young adults, and she is working in an unrepresented setting in terms of prisons. So it's really important that we hear about the work they're doing, and even at master's level, I think you can see the power of that exploratory work that Joe was undertaking there. So if you are on the Insight programme or you're thinking about it, some of the work that you might start doing is going to be so powerful for how we look after people. So I'm just going to highlight some of the opportunities that offset some of those challenges that I was talking about, and many of them come directly from the NIHR. So this slide really shows you where Insight sits within that larger pipeline, so to speak. So Insight, as you can see, is on the left of my screen under that initial experience gaining, along with internships and some of the research delivery training that one can get from the Associate PI scheme. But it allows you then to build on that if you wish to do pre-doctoral activity, and then shifting on to doctoral, postdoctoral, and then ultimately to research professorships such as Ian. But there's a whole myriad of other funding opportunities that sit alongside this, both from the NIHR and from other funders, to help support you, not just to do research as part of your career development to become a researcher, but also specific project-based funding. So for underrepresented groups, there are research for patient benefit grants set up specifically for nurses and midwives, some calls, or other calls are set up specifically for allied health professions. So I just really wanted to demonstrate just how Insight can sit within your entire career as a health and care professional, and how it can really give you that jump off point to have a really rewarding career such as the one that I've been so lucky enough to enjoy over the years. So I think that's all I wanted to say, Ian.
That's great. Thank you, Nicola. And thanks to all our speakers. I think giving you an overview of some of the opportunities. Got about 10 minutes for questions. So you can either put your hand up or you can put something in the chat. So if anyone wants to put their hand up to ask any questions to anyone on the panel, just fire away now. Let's have a look whether there's anything. Okay, so we've got Rachel's got a question, got a hand up. Rachel.
Good afternoon. Thanks for some really interesting presentations. I'm a HCPC registered biomedical scientist, and I'm really interested in research careers around healthcare sciences. And like you say, and understanding that these aren't well-trodden pathways, and I wondered if there are resources or packages that summarize the information in a place where we could, help signpost our practitioners and clinical scientists, biomedical scientists in practice who might be interested in pursuing or exploring this type of career route.
So I can start to answer this, and I don't know if Amelia's partly answering it. So Nicola's slide gives you an overview, and that will give you an overview. The NIHR has loads of different funding schemes, and it is quite complex and hard to understand. But Nicola's slide will give you the overview, and that's probably a starting point to start for that. The other, I don't know who you work for, whether it's an NHS trust or what. If it's an NHS trust, you probably could speak to your R&D department and they could give you some advice. But a lot of it is just searching the NIHR website, because there's so many different schemes and there's new schemes all the time. So it's searching the website, use Nicola's slides as a first starting point and come to things like this. The more you immerse yourself in it, the more you learn about the opportunities. So Amelia.
Thanks. It looks like everybody wants to comment on your question. So I was just speaking to a clinical scientist yesterday about who's doing the Insight programme, and they're doing their MRes. They're doing the clinical health research MRes at the University of Birmingham, and that's not specifically, it's a more generic programme. It's not specifically for clinical scientists, but there are coming up in the Insight programme. There are some programmes included, particularly at Keele University, and there's also programmes at Warwick, and there will be elsewhere, I'm sure, that are MRes specifically for clinical science. So I think it's about what you want to do your research in and what your topic of interest is, and having a conversation with somebody like Nick or Caroline or myself. We're designed to give quite broad-based information in a coaching style. So thinking about what do you want to get out of it, where are you heading, what's your topic of interest, and then thinking about what sort of opportunities are there specifically for you. So as Ian says, it is about casting your net wide, having a look what loads of different things are available. Clinical scientists are underrepresented within an underrepresented group, and so somebody was, I think it was Jed Jerwood, who is an art therapist, did a little video that I saw the other day, and he said, very few art therapists are getting funded PhD opportunities, and he used that as his superpower because so few people from his background are applying that people are actually looking for you. So you've actually got a really good position to be in at the moment. I'll shut up so that other people can comment as well.
So Nicola and Joe.
Yeah, I think I was just going to say one of the tasks we have now is that there are so many opportunities. It's nearly kind of trying to identify which ones and which are the best ones. So I think that's where some of that coaching that Amelia was talking about comes in. The other thing I just wanted to draw people's attention to is the READY project, which is a West Midlands strategic partnership, which is really trying to improve equitable access to high quality research, education and training, so that we can all make access to those opportunities. And I will put the email address into the link, but they do monthly newsletters of a lot of the NIHR opportunities, but also some of the West Midlands specific ones, because obviously there are a lot more opportunities than just the NIHR, and I think it's building those regional networks, of which the Insight programme is such an important component, that I think so important. But I'll pop that in the chat, the email. If people are interested, you can get on the mailing list.
So Joe, I don't know if you want to respond as well.
Thank you, Ian. Just to follow on from Nicola's advice, it is about networking, Rachel, knowing who's already doing any research in your area, in your specialty and in your clinical area. But Jo, in her talk, talked about having the capacity and the time. You're going to be a busy scientist in a busy lab. So reach out in your own trust. Ian mentioned your R&D department. If you don't know who to go to, obviously me and Nicola Anderson are available, and we can put you in touch with the right people, or any other projects that are going on in your trust, and buddy onto the back of that, as we did with our careers. But yeah, scientists are absolutely underrepresented, and because of your job planning, really difficult to get that time away from your clinical area. So we can help with that. Or your R&D can, if you're not in our trust.
Great, thank you all. I agree with what's been said, that scientists are underrepresented. We've got time for one more question. I have got to go to another call. So we've got another Rachel, who's a paramedic scientist at Keele, and wants further advice for someone thinking this qualification. What would a good candidate look like? So I think probably as your question specific about the Insight programme, maybe Nicola's got a hand up, but also Amelia can answer this.
I was just going to say, I work with a few clinical academic paramedics here at UHB on various parts of the pipeline. And what I would advise, I'm very happy to connect them up with you, Rachel, because I sometimes think actually hearing from the horse's mouth, for a better phrase, actually conceptualising, hearing people who are out there doing it, so speaking to paramedics on this pathway, I'm sure they'd be very happy to come and speak to you, some of your paramedic students. So if you want to connect outside of this, very happy to make those connections.
Amelia, I don't know if you want to add anything at all.
I think that's probably the best way to go. First of all, is talk to somebody who's treading the pathway that you want to. So we've got paramedics on Insight, paramedics on all sorts of MRes courses. There's loads of opportunities out there. So yeah, get connected. Hear from different people. That's a fantastic piece of advice.
So we've got one final question from Gift. Similar sort of pharmacy thing. I think the advice will be similar across all professions. Get connected, speak to people, understand what you need, what the Insight programme is looking for, and make sure you clearly articulate and answer the questions. There's a lot of stuff on the website. I know you're already linked with me, Gift, so I know we're already talking to you outside of this call, but I think it's to get connected, speak to people who have had the award or similar, and take it from there. But it's going to things like this. The more you come to things like this, the more you'll learn about what makes a good application. But there will be stuff on the website for Insight or any program, and that really tells you what they're looking for. Generally, the NIHR for doctoral or pre-doctoral awards are looking for the person. You've got to show you're committed to research and you're a leading clinical academic. The place, it's got to be credible. The project, okay, it's got to be an important project, and the PPIE. Okay, for Insight, PPIE may be quite early stage, but generally the NIHR are looking for those 4 things. And the webinars before the next round. So thank you so much for coming, and all the speakers. If you could give one last round of applause, and then I'll close the meeting, and have a nice evening, everyone.